So some questions from those who have recovered, and there are quite a few. So I'm going to try and frame it in my mind and ask you, are there any side effects that you're observing from COVID recovered patients? I've heard a number of cases where in the same family, different people, different symptoms with impact on lung and the heart. So what is the truth, and what do you do to minimize some of this? Are there any markers to keep a check?
Great. So there's huge and wide variation on how recovery looks like. Some people, if you check their antibodies, which is a marker of previous infection, will screen positive for antibodies and wouldn't even know that they have a COVID infection in the past. So that's the best case scenario where, like we were saying, 1/3 of patients won't have any symptoms. Some of us might have had no symptoms, had the infection, and now have antibodies when you test them and have no residual symptoms at all. So that's one bucket. The other most extreme bucket is someone who's had the horrible COVID, has been in the ICU with COVID pneumonia and has had extrapulmonary involvement. Many of those patients, at least in our setting, have had months and months. So we saw our surgeon in March. It's been 6-7 months since then. Still have significant residual symptoms and weakness from COVID. They come in 3 major categories. One is residual lung weakness. One is, so many of our COVID patients had heart inflammation, and some of them have persistent heart inflammation. And then thirdly, overall muscle weakness, deconditioning, and need for physical therapy and rehabilitation.